If you are among the many Americans living with chronic back pain, but you're afraid a trip to the orthopedist might immediately mean surgery, our next guest hopes to put your worries at ease. Dr. Benjamin Geddes is a fellowship-trained orthopedic surgeon with Center for Sports Medicine, treating children and adults for a variety of spinal conditions, and he says the key word this morning is comprehensive. Is that right?
That's correct.
Good to see you.
Good to see you too. Thanks for having me.
So, we have many of your doctors on from Center for Sports Medicine throughout the year. Pretty much every month we have somebody. So our viewers have kind of gotten this sense of the variety of treatments that you do, but even within spinal care, you have a variety of approaches, right?
That's correct. Yeah, we've kind of realized it's not a novel concept, but we've really embraced sort of the team-based approach. And I think just modern spine care, that's so important because the technology and the treatments have continued to evolve, and that includes surgery, which is kind of my piece of the puzzle, but also interventional care and physical therapy and some of the other things that we can provide patients.
I mentioned that you were fellowship trained. When you're in the medical world, you know the significance of that. Not always as a patient do you realize it, but explain why that's so beneficial.
Yeah, it's helpful. I mean, it's really a year just to spend time focusing on kind of the complex aspects of what you want to specialize in. So for me, you do a lot of spine care in residency, but I wanted to get into some of the more complex issues like scoliosis, tumor, some of the more complicated issues, which is certainly a part of my practice, but I also treat a lot of common conditions as well, which, there's a lot of what you see in the community.
We've been talking about the spine, but the spine extends up into your neck. So do you do a lot of treatment for that as well?
Yeah, I mean, neck pathology is a little bit less common than low back, but I still do quite a bit of it. It's probably 35 or 40% of what I do.
When you talk about like the physical therapy, and y'all have got great options for people there at Center for Sports Medicine, but if you're hurting, you don't always want to hear someone say, let's try 8 weeks of physical therapy.
Yeah, it's kind of it can be a double-edged sword, but a lot of times when you come in and you see one of the surgeons or one of our physician extenders, we'll give you some medications which help with that kind of acute pain to get it down to a more manageable level, and then the physical therapy is a really good adjunct to that.
When you talk about surgery, if it gets to the point where it's going to be a life-changing procedure for somebody to have, what types of surgeries do you perform? Yeah,
so I mean, it's a wide spectrum, and I think that's honestly why it's so important to have conversations with your patients, because a lot of what I do are small things, a little decompression, meaning where you just are removing some stuff from the spine to make more space for the nerves. That's an outpatient surgery,
Really?
And that's something that you're back to work within weeks. But I also do big reconstructions for tumor, for scoliosis, and that's a much different recovery process, but can still have great outcomes. So there's really a wide spectrum, and that's why I think it's important. Even early on, you may say, it's a little bit scary seeing a surgeon, and I get that. But it's good to know sort of the natural history of your problem, but also things that can be done for it, because it is different. You would try more conservative care or longer conservative care if it's a big reconstruction that's going to lay you up for 3 to 6 months. Whereas if it's a 2-week recovery, well, sometimes that makes more sense to just kind of fix that, like a disc herniation, for example.
On the scoliosis part of it, we learned so much over the years. So things we know now, maybe we didn't know 20 years ago. You didn't know 20 years ago. If you're an adult with scoliosis, but you've had it always, can you still find relief? Yeah,
I mean, scoliosis is a funny thing. I spend a lot of time talking people out of surgery, honestly, for scoliosis.
Really?
But for the people that really need it, they can do extremely well. But just because you have a curve in your back doesn't mean it's something that has to be corrected. If you start to develop more arthritis, disability, pinched nerves, which would be like a sciatica type phenomenon, then those are certainly things that we can treat, and not always with a big reconstruction. Sometimes if you just have the nerve pain, going in and doing a small outpatient sort of cleanup job in order to free up that nerve root can really give you good relief. So there's a spectrum.
So is that what most back pain is nerve related and not so much anatomically related?
That's a combination. I mean, I think as a surgeon we get a little bit more excited when we hear you have arm pain or leg pain, because really when people say don't have back surgery, the outcomes are not great. Really, for nerve pain, we do really well. I mean, that is something we can really fix. Back pain or neck pain is a little bit harder. A lot of times they kind of come together, but if you have a lot of arthritis in your back, then sometimes being pain-free is not realistic, but we can do things to help manage it, to maybe cut your pain in half or 70%. And sometimes that's surgery, and a lot of times that's interventional things like shots and ablations and stuff that our non-operative physicians can provide patients.
When you do like the shots and the ablations, which you say so smoothly, does it work for everybody?
I mean, nothing we do is 100%, unfortunately, but a lot of folks can do well, and there's a lot of new emerging sort of interventional treatments and surgical techniques that have provided more treatment options for folks. And so I think a lot of times we can find something that works. There's also medications. We've gone away from a lot of the narcotic stuff, but there are some other medications that can be helpful for nerve pain, et cetera. So that's a part of what we do as well.
From a preventive standpoint, I have doctors on who will say that sitting is the new smoking. We sit a lot. And if you're not sitting properly, then I guess you can kind of let the chair do the work for you.
Yeah.
So are there some basic just posture techniques we can
Yeah, I mean, I think a lot of people come in and want to talk about posture and things, and I think they all play a role. I think honestly, for me, I think even folks that I'm like, you know what, I don't think you're ever going to need surgery or maybe even a shot. I say do a couple physical therapy sessions, because I think going and having them evaluate you in real time and things that you're doing and working on a routine that's just good back hygiene, and that's flexibility, that's strength, and that's stuff that they can really help you with. And whether you like that and you keep doing it or you just acquire some of those skills and just incorporate it in your life, it'll help prevent some of those flare-ups you get.
We had somebody from your physical therapy office on not long ago, and it was really impressive to me because she talked about, the small ratio of caregiver to patient that you get there. So the eyes are really on the patient.
Yeah. They do such a great job. And there's lots of things they do as well now too. Like dry needling has become really popular. And I've had probably over the last year a lot of my patients, especially with that kind of axial back pain that maybe there isn't a perfect fix for, that really helps kind of loosen them up. And there's a lot of great therapists in Chattanooga, but the advantage of kind of having some under our own roof is really the communication piece. So if they come to us and say, like, this patient's maybe not progressing as we'd like, maybe we need to escalate care, maybe we need to try a shot, maybe they do need a surgery. And so kind of getting that feedback, is their strength improving? And if it's not, well, maybe we need to intervene, because that is something that can become more permanent over time.
So before I let you run, we've talked to the physical therapy side of that comprehensive benefit. Obviously there's you, but depending on what the person's need might be, are there other surgeons you might also refer them to as well?
Yeah, a couple people a month I'll see, and they have hip arthritis. And we thought it was their back because they're having buttock pain. Well, they have bone-on-bone hip arthritis. Let's send in one of our hip partners, or same kind of for the shoulder. It's their rotator cuff, or they have shoulder arthritis. So having kind of everyone under one roof, or is it carpal tunnel, cubital tunnel? We have hand surgeons that help with that. So yeah, there's a lot of overlap. It's really nice to have a big team.
You make it seem very optimistic and worry-free, and that's a good thing for your patients. So here's the number if you want to reach out to them at Center for Sports Medicine. 624-2696 is the phone number. As you well know, they have locations all across the viewing area, but that's the phone number at McCauley Avenue. Sportmed.com is where you can also learn more, read more about Dr. Geddes and the rest of the team. Thanks so much.
Thanks so much for having me.
I got hurt in a car wreck. Give me one good reason why I should call the Insiders.
How about 3 great reasons you should call us?
1, it's easy.
2, there's no upfront cost.
3, the results. If you've been hurt